Okay, the patient's perineum has been cleaned. I'm going to go ahead and walk in. Hi, my name's Jay. I'll be your nurse today. Can I go ahead and ask your name and date of birth? Okay, great. Any known allergies, especially to latex? No? Okay, good. Well, today I'm going to be inserting a Foley catheter. It'll run through your urethra into your bladder, pull out any excess urine you can't expel yourself. Before I do this, I'm going to go ahead and provide us some privacy. And I'm also going to wash my hands. Alright, to get started, I'm going to go ahead and raise the bed to working height. I'm going to lower the side rail. I'm going to go ahead and put on a pair of clean gloves. And I'm going to prepare the patient. Go ahead and drape her. Okay. Position the legs. Alright, now I'm going to go ahead and prepare my supplies. I'm going to go ahead and take my drape and place it under the patient, shiny side down. Alright, I'm going to have to lift your hips up a little bit so I can place this drape under. Okay, great. Doing good. Alright, now that I have everything prepared, I'm going to go ahead and go sterile. So off with the clean gloves and for my sterile gloves. Alright, my hands are now sterile. I'm going to remove the specimen jar just off to the side for later so we can obtain a culture. I'm going to move my 10 cc's of normal saline syringe, betadine, and lubricant to the bottom level of the tray. I'm going to discard the top tray. And I'm now going to go ahead and move my box to the bed of the patient. Okay, I'm going to go ahead and prepare my betadine swabs to clean when I'm ready. Open my lubricant so I can put it on my catheter when I was ready as well. going to go ahead and take the cap off of my syringe of normal saline and connect it into the port here. At this point, I would go ahead and spread the labia minora and begin cleaning. I would go ahead and lubricate the tip of the urinary catheter. I would spread the labia minora again, visualize the urinary meatus, and begin inserting from about 1 inch down. Alright, I would insert until the point where I see urine returning, and then I would go 1 more inch. Okay. At this point, I'm going to go ahead and inject 10 cc's of normal saline into the bulb to anchor it. I'm going to go ahead and remove my syringe. Okay. And I would give a little gentle tug just to make sure it's anchored. Okay, it's in there. Alright, at this point I'm going to go ahead and go from sterile back to clean. Go ahead and wash my hands again, put on some clean gloves. Go ahead and anchor the catheter to the leg of the patient by the tubing. Okay. And I would go ahead and hang the bag. Now that the bag is hung, I would go ahead and document how the patient tolerated the catheter, the color of urine coming out, if there's any consistency or odor, I would document that as well. I would go ahead and remove my supplies, and I'd also take a culture to send off to the lab. I would do this by removing the top of the specimen jar, pulling this tube out, and without touching the sides of the specimen jar, I would release some of the urine into the jar, put this back in the proper position, cap the jar, and send this off to the lab. Alright, and as for removal of the catheter, I would come in again, go ahead and remove my supplies here. I would come in again after the patient. Introduce myself, say hi, my name is Jay, I'm a student nurse. I'll be removing your Foley catheter today. I'm going to go ahead and provide us some privacy. I'm going to wash my hands and I'm going to put on some clean gloves. If you would, go ahead and state your name and date of birth for me. Okay, great. I would go ahead and drape the patient. I would remove the tape from the catheter tubing. I would grab my syringe, put it into the port here, document and remove 10 cc's of normal saline that I'd put in originally. Okay, set this off to the side. Okay, I would grab a tissue and hold it over the labia minora while spreading a little bit. I'd go ahead and ask the patient to take a deep breath and hold. I'm going to go ahead and remove this. You're going to experience some pain, or you might experience a little bit of discomfort. Shouldn't experience any pain, but maybe some burning. I would go ahead and pull the catheter, I would wrap the tip in a napkin, and I would put the end in my red bag here with the napkin still wrapped around it to make sure no urine got anywhere. At this point, I'm going to go ahead and remove the bag from the side of the bed and set it here for the time being. I'm going to go ahead and clean the patient, and I would re-drape her. I'm going to go ahead and remove these soiled gloves, wash my hands, and put on new clean gloves. Okay, with my new clean gloves on, I would grab the bag, I would take it to the bathroom and measure the amount of urine, document color, consistency, odor, how the patient tolerated the removal of the catheter. I would also document that I removed 10 cc's of normal saline from the bulb, and then I would discard of my supplies, and that's it.